to our presentation materials. So welcome to the October Health Innovation Community Partnership. We're very excited to spend time with you today. And to that end, we'll just go ahead and kick it off. As always, if you are joining us via Zoom, we want this to be an interactive experience for you. You are welcome to raise a hand, to put a comment in the chat, and we'll call upon you at the appropriate time. We also want our in-person experience to be equally interactive. So if you have a comment or question, please make sure you raise your hand. We'll come to you with a microphone at the appropriate moment so we can have that rich conversation and dialogue. As a reminder, this meeting is being recorded. In about a week's time, it will be posted on the HICPLA.org website, the recording, the chat transcript, and the meeting materials. So if you know someone who should have participated in today's conversation and maybe wasn't able to join us, please direct them there for all of the materials from today's meeting. Okay, let's go over our agenda as we begin. We're going to have an update from our partners at the LA General Medical Center. In particular, my wonderful colleague, Dr. Carla Gonzalez, who serves as the medical director for the Wellness Center, as well as the director of urgent care here at LA General. Then we have a wonderful gathering of individuals from the Reentry Health Advisory Collaborative who are going to share with us some of their work and experiences over the last few years. We're going to take a networking break at that time. This break serves two purposes. One is to allow our wonderful translators a few minutes for respite as we go through this very dense presentation. And the second is we really want to encourage those who are able to join us in person to have a little moment for networking and getting to know the other people in the room. We encourage the same for the people that are joining us via chat. At that time, we'll ask everyone to introduce themselves in the Zoom room so that we can get a better understanding of who's joined us here today. After that networking break, we're going to move forward to a presentation on Care First, Jails Last. You'll see a little theme here today about how the county is addressing the issues of justice, reentry, and Care First, Jails Last as an initiative. Then we invite our colleagues from Prime Store and Centennial Partners to join us with an update on what's happening on this fabulous campus of ours. And then we'll invite any of our partners to make announcements about things that are happening in the upcoming month so we can all participate in the events and opportunities within our community. As we begin, I want to start, of course, by always reading aloud our HICP guiding principles, which were adopted in 2017 as a way to kind of set the table and set the tone for our time together. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain their reasoning and intent. We will share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. And with that, I'd like to make an announcement. October is National Domestic Violence Awareness Month. We are so delighted, as always, to be in partnership with our colleagues at the East Los Angeles Women's East Los Angeles Women's Center, who will be hosting a series of events this month, and we invite you to participate. In particular, we wanted to let you know about the upcoming Mujeres de Paz event. The next slide, please. Thank you. It's the Candlelight Vigil for the Mujeres de Paz event, and that will be on Thursday, October 17th. The walk will begin at 6 o'clock in the evening. I don't know if we have our colleague from East Los Angeles Women's Center with us. Is Ruth here? All right. Well, we invite you to join us. These materials will be sent around to everyone here in the meeting today. Again, October is Domestic Violence Awareness Month, and in particular, East Los Angeles Women's Center's Candlelight Vigil on Thursday, October 17th. We would love to see you there.
Ruth is online, Heather.
I'm sorry?
Ruth is online.
Oh, fantastic. Ruth, would you care to share with us some comments about the event?
Of course. Thank you, Heather. Good morning, everyone. Like Heather mentioned, this is our annual vigil that we have. I'm sorry the camera's not working on my side, so I wish I could see all of you this way, but um, we are going to be having it on Thursday. This is a wonderful event. It's out for the community. We walk in remembrance of those whose lives were lost due to domestic violence, but we also walk with those who have been able to break the cycle of violence and are able to walk with us. There is a special moment where we light candles throughout the event, but there's also a moment where people can come up and talk if they want to talk about their experience, and then welcome other people as well to be able to share and have that moment with us in our community. It's going to be at ELAC. We start off at Metnick by the Belvedere Park at the Mural of the Virgin. We walk towards ELAC, and then that's where we have our moment there. So thank you all. If you're able to come, we really welcome you there. Thank you. Thank you, Heather and Rosa.
Thanks, Ruth. So happy you're able to join us. And I'm so sorry I was not paying attention to the Zoom attendance. My
It's
apologies.
okay.
I am seeing some comments in the chat from our online interpreter. Have things been resolved, Elijah, with the interpreter? You're working it out. Okay. So as always, our meetings are offered in interpretation in Spanish for those in the room. We have an in-room interpreter for those joining us via Zoom. There's also interpretation available and accessible via the globe at the bottom of the screen. Sounds like we may be having a little bit of challenge, so please bear with us as we sort that out. A note to
Heather,
all speakers. Yes.
can we have maybe Ruth say a few words in Spanish if people aren't able to hear the Spanish interpretation yet?
Absolutely.
Ya. Buenos días a todos. Gracias por poder estar aquí con ustedes compartiendo esto. Así como ha dicho Heather, tenemos nuestra vigilia anual. Esta vigilia es compuesta para conmemorar el mes de la concientización para la violencia doméstica. Caminamos todos en memoria para esos que desafortunadamente perdieron sus vidas por la violencia doméstica, y también caminamos con los que han podido quebrar ese ciclo de violencia doméstica y con familiares también de ellos. So, esto es para la comunidad. Nosotros vamos a poder estar también caminando. Empezamos a caminar con el mural de la Virgen allá en Metnick, por el Parque Belvedere, y caminamos hacia ELAC, y de ahí esa manera ahí estamos juntos, podemos compartir ese tiempo como comunidad, tratando de quebrar ese ciclo. Hay un momento para poder hablar, si esos que quisieran hablar, compartir algunas palabras acerca de cómo ha sido la violencia doméstica o cómo ellos han pasado y han quebrado ese ciclo. También tenemos un momento para conmemorar las vidas que han sido perdidas, y estamos prendiendo velas para poder estar todos juntos como comunidad, tener ese momento para poder crear una conciencia comunitaria. So, gracias a todos y espero verlos ahí. Thank you.
Thank you so much, Ruth. We appreciate it.
Buenos días, mi nombre es Edith. Tengo una pregunta.
Good morning, my name is Edith, and I have a question.
Me gustaría saber si una chica que sufrió de violencia doméstica
I would like to know if a girl who has suffered domestic violence
y necesita su ayuda, ella necesita pagar esas consultas.
and if she needs help, does she have to pay for the consultations or appointments?
Me gustaría recomendar a alguien de mi familia que ha sufrido de violencia doméstica y no tiene para pagar una consulta.
I would like to offer these services or be able to tell of the services to a relative of mine that has had domestic violence and doesn't have money to pay for a medical appointment.
Thank you. So, Ruth, if you'd be so kind maybe to respond in terms of how you would counsel
Yes.
such a young woman, that would be fantastic. Thank you.
Thank you, Heather. I'm going to answer in Spanish for Edith. So, buenos días, Edith. Gracias por su pregunta. Yo puedo contestarle acerca de la consejería, más de los servicios mentales que se puede ofrecer. Para nuestra agencia específicamente, si una persona ha pasado por violencia doméstica, no importa si lo está pasando ahorita, recientemente o en el pasado, nuestros servicios son accesibles para ella y son gratuitos. Nosotros no cobramos para nada, no nos importa tampoco estatus legales, nosotros no preguntamos acerca de eso. Lo único que queremos es proveer ayuda. Lo que ahorita pues, estamos teniendo es desafortunado porque también viene con eso, es que cuando uno provee un servicio gratis que está impactado, pero tenemos nuestros grupos de apoyo abiertos, también tenemos nuestros grupos de educación de violencia doméstica abiertos también. So, refiera a su familiar con nosotros, les voy a poner la línea de crisis, está también en nuestra línea de oficina, está en el flyer que acaba de poner Heather ahí enfrente. So, si usted quiere decirle que les llame a nosotros, nosotros con mucho gusto podemos hablar con ella y a ver qué son los servicios añadidos, además de los servicios mentales, qué es lo que puede adquirir con nosotros también.
Thank you. Ruth, would you be
Yes.
so kind as to repeat your answer in Spanish, in English as well?
Sure.
Thank you.
All of our services are free. So it doesn't matter if somebody is currently going through domestic violence or has a history of domestic violence. That's not a time frame that we focus on. We just want to get somebody the help. So all of our services are free of charge. We do not ask for any documentation or legal status or any of that. Right now, though, what comes with when you have all of these free programs is that sometimes you're impacted, which is what's happening with our individual therapy. But that doesn't mean that we will not be able to give any service. We have a lot of great support groups that are open right now, educational groups as well when it comes to domestic violence, on top of all these other services that we might be able to cater to whoever comes in through our doors, and we assess them. We're able to see if there's any other programs they may qualify for. So I'm going to put on the chat our hotline number, but you could also call our office number, which is literally on the flyer that is being projected to you right now. So you can grab it from there and you can call our office, and we're more than happy to get that process started.
Thank you so much, Ruth. And you'll notice there's a couple questions for you in the chat too about additional resources for survivors, including rent relief and the therapy services, which you already mentioned. Yes. So thank you so much for responding in the chat to those questions.
Of course.
Do you know anything about rent relief in particular?
So for rent relief, there are certain programs that the county has been able to do, but we have a program within our agency that is able. We do not provide actual financial support when it comes to that, but what we are able to do is provide a navigational system. So we have community workshops. We also have able to put them in the proper programs to get them started that are made specifically for domestic violence survivors.
Fantastic. Thank you so much, Ruth. Appreciate the information and appreciate the interest from the audience as well.
Yes.
And if you have additional questions, please raise your hand or put your comment or question in the chat, and hopefully Ruth will respond. Thank you. With that, we will move on to our next presentation. We're delighted to welcome Dr. Carla Gonzalez up to tell us some stuff about what's going on here at the Medical Center.
Good morning, everybody. Buenos días.
Buenos días.
Buenos días. Buenos días.
Buenos días.
Nice to see everybody this morning. So I'm going to give a couple of updates on behalf of our leaders, Mr. Jorge Orozco and Brett Spellberg. So a couple of important updates on COVID. This is always a great question about COVID. What is the status of COVID? So overall, Dr. Spellberg wants us to know that we're in a good place. Okay, this is a very manageable stage to be in right now. So I'm going to point out just a couple of things. If you look at the summer peaks, we always have summer peaks. We know that we have a winter peak and a summer peak. So if we look at the summer peak from 2020 and we look at the summer peak from 2021, we can see that those were very high. The summer peaks subsequently are very manageable. Of course, we wish they weren't there, but they're manageable. So thank you all for doing the great work of, getting vaccinated, staying safe, staying well. We are in a very good place with COVID for this. Couple of other points on COVID. Besides the low summer peak is the severity of the illness. So we always talk about hospitals and if they get crowded. Right now, I can tell you that our hospital is managing these quite well. People that are coming in are not really being hospitalized for COVID, thank goodness. They're able to manage mostly at home, stay at home, supportive care, staying home from work, resting, drinking fluids. And I would just say that overall, I think that we've done a great job here. It's not to say that COVID isn't with us. I think what we'd like to say is that we've learned to kind of live with it and that it's become part of our regular viruses. And so happy to be in this place. So, okay. I do want to talk a little bit about flu vaccine. And Heather, how much time do I have? Is it? Oh, okay. So I really want to talk about the other important virus that is coming and one that has been around for much, much longer. So this is our influenza season. It started, you may have heard the buzzwords, some people even got vaccinated. So I just want to say a couple of words on vaccination and how and why it keeps us all safe. So who should get vaccinated? It's everybody over age 6 and for age 65. Over age 6 months. And for everybody over age 65, there's a special vaccine. That special vaccine allows for better immunity to be created because as we age, we also have less immunity. That's not just for influenza, that's for all illnesses. So people often ask about the egg allergies. Okay, egg allergies. It's really only people who have severe allergies, and even people who have severe allergies can take these vaccines, but they should be doing them at a hospital-based center, somewhere like here, where if there's something that happens, they can go in and be seen for this. For the most part, we don't have any vaccines that will cause this egg allergy eruption anymore. Okay, we're using vaccines that really anybody can take at this point. We're also not using the live vaccines anymore. They're very far and few between. Those are the ones that get sprayed in the nose. We're using an inactivated vaccine, and it's usually the one that you get in the arm. The peak activity of flu, I get this question all the time, and this is really important, is why do I need to get another flu vaccine if maybe I just had one in January? It's because our flu vaccine covers us from the months of December through February. Think of it like a school year for influenza, okay? But it starts in December and ends in February, and actually sometimes can go even really late into, March and April. So, if you're getting another vaccine at this time, it's different from the one you got in January. So this is why sometimes there may be more than one vaccine a year. And then in terms of side effects of the flu vaccine, I want to point out something very important, and I want everybody to know this. We don't get the flu from the flu vaccine. It might make you feel a little crummy. I put some of the side effects here. You might feel nothing, but you won't get the flu. Again, it's an inactivated vaccine. So I'm going to move into the why. Okay, why we should get vaccinated. And people always say, I've heard I don't get sick. I heard it's not that big of a deal. I've heard I just don't want to take it because I don't want to be told what to do. So a lot of different reasons. All of them are important reasons, but they're things that we can talk about. So we talk about severity of illness. And if there's one virus that we all fear, actually probably more than COVID at this point, it's the flu. And just because it causes so much chaos, it means that sometimes people will stay home, right? People will lose time out of work. Sometimes people do end up in the hospital. And it also means that parents who have to take care of kids or caretakers who have to take care of the little ones that get sick, they also have to miss work. and school time lost. So a lot of important reasons, but I want to talk a little bit about the severity of the illness. How bad is the flu and what can happen? So the flu vaccine actually prevents many types of illnesses of the flu in which you actually have to go see a physician. How many people here have had the flu? Okay. And it feels pretty awful. And of those people that raised your hand, how many people actually had to go and see a doctor for it? How many people actually walked away with anything different than cold, like rest, relax, stay at home, right? Probably all of us have gotten that. It's gotten to the point where if you are vaccinated, in terms of severity, you can stay home, you can rest, you can do what we call supportive care. Tylenol, ibuprofen. Okay, and a couple of numbers. So it is the flu vaccine is estimated to have prevented 7 million influenza illnesses and 3 million influenza associated medical visits. So I don't take these lightly. So every time you have to go to the doctor, you are missing time away from your life, right? You're missing time away from work. We also see an overabundance of these visits in urgent care. So there's also other issues that we have to deal with. Not that influenza is not important, but really we're going to tell you to go home and rest if you've had your flu vaccine because you have some level of protection, and we're going to send you home to rest, right? So this is really also a hospital care issue and a burden. Okay, so some of the numbers here, a person that is vaccinated, it has a 26% lower risk of ending up in the intensive care unit. So this is really important. If you do end up in the hospital, if you're vaccinated, you have that level of protection where maybe it's not so severe. Okay, also the same for a study in New Zealand. That among adults hospitalized with the flu, the vaccinated patients were 59% less likely to be admitted into the ICU. And in 2014, we also looked at children. So the risk for children for flu-related pediatric ICU admissions decreased 74% during the flu season of 2010 through 2012. So I talked about severity, and I also want to talk about getting vaccinated to protect the people around you. So remember, we are vaccinating. There's people under 6 months of age that cannot get vaccinated. There's people over 65 that have lowered immune systems. So overall, when we're vaccinating, we are taking care of ourselves, but we're really taking care of our community. And I like to use this little quote. I've heard you guys have all heard of it. It's the In Lac Ek. Tú eres mi otro yo, you are my other me. Si te hago daño a ti, I do harm to you. Me hago daño a mí mismo, I do harm to myself. Si te amo y respeto, if I love and respect you, me amo y respeto yo, I love and respect myself as well. So I just want to remind everybody, again, getting vaccinated, we're really doing this for our entire community. And I know that all of you here, this is a really important thing to take care of our communities and stay healthy. I'm going to share these influenza disparities with you. These are really important. So the reason why I want to share these is because we're in the business of talking about disparities. And we want to know what's happening out there. So I want to show you guys about the flu uptake and the risk for ending up in the hospital. So this first one here, talks about the rates of people that were hospitalized with the flu. An obvious disparity that we're seeing already is the purple line, in which African American, Black Americans end up in the hospital at much higher rates. Okay, if we look at our population as well, the Hispanic population, the green level, right? We can see the numbers downtrending. Something is moving in the right direction. So overall, things are getting better. But what about flu uptake? in the vaccine, like flu vaccination coverage. So you might not be able to see this one very well, but we can see that the white population takes up the flu vaccine at much higher rates than our other counterparts. So when we have this kind of disparity in that our people that we're interested in taking care of, people that are vulnerable to this disease, are not taking their vaccines, this is really a cause of issue for concern and for a conversation. So we talked a little bit about the flu not giving you the actual flu, really important. And here are my references. And I do want to open it up to questions that people might have about flu vaccine.
Does anyone have a question?
Just to be clear, I'm sorry. Just to be clear, the vaccines are different because the flu is a little different.
So that is a really good question. Are you asking about kind of like why a different flu vaccine every year? That's an excellent question. So with the flu vaccine, we do a lot of research around predicting what the flu is going to look like in the coming year. So the flu vaccine that we have today is based on the last few years of what the flu has looked like. And it changes based on that. So we try to, it's kind of like a little bit of chasing a moving target, but we're getting better and better at it. So that is the reason for having to take it every year, is because the flu does change.
Do we have any other questions? Oh,
Buenos días a todos. Mi nombre es María Ponce de León. Soy promotora de CPSD. Y mi pregunta es,
Good morning. My name is Maria Ponce de Leon, and I have a question for you.
tenemos a veces niños que están en la primaria y muchos doctores de pediátricos no les permiten, a veces no es obligatorio tomarse la vacuna, ponérsela.
And so many of the children that go to elementary school and they go to the school, many of the pediatricians no les permiten que se pongan la
Ya,
vacuna.
a veces.
Los pediatras.
Sí, no es obligatorio.
The pediatrician says that it is not mandatory for them to get the flu vaccine.
Y hay muchos niños que en estas temporadas se enferman y son los que a veces enferman también a los adultos.
And so many children during those periods, they become ill, but not only that, they also pass it on to the adults that are around them.
Entonces, ¿qué podríamos hacer para que nosotros como promotores decirles lo importante que es? Tanto nosotros lo hacemos en la calle y en las escuelas, pero dicen que los pediatras, es okay, don't worry.
So how is it that how could we as promoting this for them to get vaccinated, work with the pediatricians in order for them not to say it's okay for them not to get the vaccine?
So that is a very good question. I think what we might be seeing is a couple of maybe degrees of separation in what was said in the clinic as to how it's translated. So I can tell you that if you're a physician out there, pediatrician, family medicine, or any other physician, majority of physicians are going to tell you, and they're going to use the words, it is my strong recommendation that you receive the flu vaccine. Physicians, though, have also been taught that people will make decisions, right? And they make the best decisions for themselves. So when people are hesitant to get a vaccine, it's really important to begin asking the conversation of why. So maybe what that person heard is not necessarily the physician not telling them how important it is, but maybe they're like, well, they're not forcing me to do it. And of course, that doesn't happen in today's world. We don't force people to get vaccines. So maybe they interpreted that different. But more important than that is to start that conversation of what's the hesitancy? What are we worried about? What kinds of things are making people not want to get vaccines? I think that is the important piece, and moving the needle on those things. Starting with maybe some of these questions and conversations. Are you aware that, our people are ending up in the hospital at higher rates? Do you know that our people take up the vaccine at lower rates? Or maybe what is it that's worrying you about the vaccine? Is there any questions that I might be able to answer? That's the way we engage people about vaccines. Any other questions?
Any other questions?
There is a question that I get, and I get it all the time. So there's two myths, right? The first myth we already just hopefully addressed is that the flu vaccine does not give you the flu. So it's an inactivated vaccine. Your body will respond to it in the appropriate way. Your body will actually make antibodies. In the process of making antibodies and our bodies doing the beautiful thing that they do, it could make you not feel well. That is the act of making antibodies. It lasts about a day or two. Okay, so the flu vaccine will not give you the flu. The second question is, I got the flu vaccine and I still got the flu. Okay, so there's a lot of things that we do for protection. Again, we talked about the severity and ending up in the hospital and having to go to the doctor versus just staying home. So yes, the flu vaccine does not protect you against getting it all the time, right? But it does help with the severity of the illness. I equate it sometimes to if you wear a seatbelt, does it mean that you're not going to get in a car accident? Or if you wear a seatbelt, does it mean that you might not be injured? It doesn't mean that. It means that the impact and the severity will be less. Any other questions? Should I answer some? There's more. Okay. All right, so the last few announcements, really important announcements, it's voting season. So I want to let everybody know that here on our wonderful campus, we are able to vote on site. So please, everybody, read up, ask questions, discuss amongst each other, listen to what's going on there, listen to everybody, all your options out there. This is our time for our voice to be heard. So please vote. If you're here on the campus, know that there's a place to vote as well. And also for National Hispanic Heritage Month, we're celebrating in a big way this year. We're really excited. On October 1st, we celebrated the 3rd annual National Latino Physicians Day. And that was really exciting, the first to celebrate here on our campus, and the fiesta continues. So on the 9th, we will be having something here on the campus. 10 to 1, there'll be entertainment and there'll be food. So please join us. Please, we want everybody there dancing with us. Okay, and then for the Wellness Center. So our fall fiesta evening is going to be November 1st. We will be showing the movie Coco. Everyone is invited. Please come in whatever way you can. Bring the kids. We love seeing the kids. But if not kids, bring yourself. That's really important too. We have a health fair and we'll have resources. We'll have food as well. And it'll just be a wonderful time to kick off the next 3 months of 2023, 2024. Okay, that's it for me. Thank you.
Thank you, Carla. So with that, we're excited to first, before we let it go, I want to say, as Carla mentioned, October 1st was National Latino Physicians Awareness or Appreciation Day. And we have our own Latino physician here, Dr. Carla. And we just appreciate you so much, Carla, for everything she does on behalf of the community, this medical center, and of course, our wellness center. And with that, we're so delighted to move into our next presentation. We have known about this group, the Reentry Health Advisory Collaborative, now for several years and been so impressed with the work and effort they put in. We really invite them to come forward and share with us some of the the learnings and the experiences you've had in advocating for the reentry population. So thank you so much for joining us today. I'll let you guys come up and introduce yourselves. And I know we're joined by a couple of your members as well via Zoom. So it's going to be quite a collective today, sharing with us your program.
Thank you so much, Heather, for having us. Good morning, everyone. Thank you so much for being here today and for having us here today. My name is Maria Gonzalez, and I am the chair of the Reentry Health Advisory Collaborative. I am also founder of Pride and Truth, and I am a legal coordinator for the Youth Justice Coalition, and also with many other coalitions that are leading a lot of the work here in LA County to be able to help folks that are impacted by incarceration and also just the injustices that have been happening in the system. I am also a first-generation immigrant, and I am also formerly incarcerated, and I'm a mother. So thank you for having me. I'm going to introduce our team. Go ahead.
I'm Califia.
I am Sandy Arevalo with the RAC, and I also work in the forensic mental health reentry space and also formerly incarcerated.
I'm Sergio Garcia with the RAC. I'm a substance abuse counselor, and I'm also formerly incarcerated.
And again, I'm Califia Boom with the RAC. And I'm going to dive into the presentation. The RAC was founded
Right here. There you go.
Okay. The Reentry Health Advisory Collaborative was founded in 2020. Oh. Okay. Can you hear me now? Okay. The Reentry Health Advisory Collaborative was founded in 2020 by 11 justice impacted members and for family members of a system impacted sharing. Wait, that's a system? Okay, yeah.
So sorry. There we go.
Okay. A system of system impacted people sharing critical insights through their lived experience of local justice systems, community reentry, and barriers to informing policy and government. RAC advocates for resources, policies, programs, and jail diversions programs, often challenged by a lack of socially and culturally acceptable social and health services, education, and career development programs, barriers to employment and racialized equity, racialized health and mental health disparities.
Thank you so much, Califia, for introducing who we are. So what this means is that we are 11 individuals, 9 to 11 individuals that are system impacted, whether we're formerly incarcerated or we have a loved one that has been incarcerated and has been impacted by the injustices that have been happening around the county jails. So with that being said, we'll go to the next slide and we'll show on how these disparities happen in the justice county jails here in LA County. So as you can see, we have this slideshow.
Okay, so just some background on the disparities that occur in the criminal legal system in LA County. So despite efforts to reduce the jail population and increase diversion, LA County continues to be over-policed and incarcerate many individuals from Black, Latinx, and Indigenous community at proportions that are higher than the makeup of LA County residents in general. So there are over 15,000 individuals incarcerated in LA County jails. 40% are pretrial, which means that they haven't been convicted of an offense. 40% have been diagnosed with mental health needs. 30% are Black or African American, yet Black or African American people make up only 8% of LA County's total population. 54% are Latinx, yet 48% of the county's population is Latinx.
Yeah, so what this means is we're still having to advocate for people that are still in the LA counties. This doesn't mean that it's just people that are serving time in the LA County. This is actually too with a pretrial, which means that they're not convicted until proven guilty. So during COVID, a lot of people were passing away, not even being convicted of anything that they were charged for. So there was a lot of people that were hurt, damaged, families were not being informed that their loved one passed away. So it is so important to always keep these percentages updated. These percentages that we have on this slide came from the Vera Institute Care First LA database back in June of 2022, which means that we're still getting numbers updated as the years go, and the numbers definitely they fluctuate to go up and down. So this is what we're dealing with right now with the LA County jail system. Right here, we collaborate with different organizations and different coalitions that are in fact doing work that helps what's called the Alternatives to Incarceration. LA County has what's called the Care First Jail Last initiative, which brought the Alternatives to Incarceration office. What this means is that they are working on something to help people not to be incarcerated or have excessive incarceration, and start implementing what's called alternatives to incarceration, which is like diversion programs, or even working with the district attorneys and the courthouses into seeing how we can help this nonviolent crime people that are sitting in jails, being exposed to COVID, to the flu season, to many different type of diseases that are going on in there. So the RAC continues to hold government and community leaders accountable to the visions for a care first future. They continue to participate in public comment internal county meetings and are even voting members in some county groups. They bring in a lived experience perspective and center racial equality, participatory budgeting, and harm reduction. This is coming from one of our RAC stakeholders. The RAC has participated in several alternatives to incarceration group works sessions and has been able to submit recommendations to the LA County Board of Supervisors for policy change. This is another RAC stakeholder. So we are out there, we are communicating, we are advocating, because as we know, there is also a lot of challenges that come with this type of advocacy. So our duty is to make sure that LA County holds the position that they're supposed to have when it comes to reentry for folks. So meaning there's a lot of funding that's supposed to be given to a lot of nonprofit organizations that are doing intervention work, that are implementing alternatives to incarceration, implementing like a criminal record expungement, so that people can have a better future. So the RAC's responsibility, one of the responsibilities that we have is for us to oversee and make sure that this is happening in LA County. These are some of the benefits that would be if we included formerly incarcerated people, individuals in government policy and program decision making. So we have a lot of different benefits that can come from this. Sergio, do you want to read?
Oh, I don't need that. So before this, we were going back and forth, and I'm like, I'm gonna hide behind the camera, so I don't have to get up here and share. Or I could just take notes, because I forgot to mention I was in the secretary administrative. I was like, no, it's okay, you go ahead. But here I am. So thank you for the invite. So yeah, and saying that and sharing that about hiding, it's like that's something that we can't do. I think that there's a lot of people depending on us, and with this lived experience, we do have something to bring to the table, and it's important to bridge that gap between the community's policy and those who have the lived experience. So it provides firsthand expertise in reentry systems and services, fills the knowledge gap for policymakers without firsthand justice experience, on norms, barriers, facilitators, systems, and transitions. Inform policy decision makers on practical approaches, reducing unintended harm and consequences of policy and programs. Reduces biases, informs equity. And some, just let me see the phone. Did it again. Oh, I'm gonna have my back to you, sorry. So humanistic values that provides insight on human impact of disproportionate justice system disparities, support meditation and cultural brokerage, establish trust and builds meaningful relationships for end users of systems, facilitating understanding of best ways to implement human-centered programs and policies. Some added diversity in social policy decision-making, improve diversity in decision-making for those most disproportionately impacted by the justice system. And one thing that we're still doing and gathering data on is the LGBT community and the incarceration, depression rates, mental health, substance abuse, lack of services. And then our continuous focus on root causes of incarceration and policy and programs, emphasize root causes of justice involvement, examples, criminalization of poverty, health equity, limited opportunities for communities, to reshape and successfully reentry and diversion services. Thank you. Maria?
So those are some of the benefits. One of the things, like Sergio said, is we're still collecting data on the LGBTQ community. We are noticing that there is really not a lot of information on what goes on with them inside while they're incarcerated. And these are people that actually are being affected even on the double source because their identity, right, and also their health is it's at a different level of risk. So this is something that we are implementing right now. We're actually going to be working on very closely to bring in that data and to bring in that voice for them, because there is a lot that goes on in there that we don't know about. Yeah, and with that being said, we can turn it into a question and answer.
Great. Thank you guys so much for being with us today. I know you have some colleagues on the Zoom. Does anyone want to, say something, say hello to us from our Zoom?
Yeah, sure. Can you hear me?
We can.
Hey, good morning, everyone. Thank you again for the opportunity for us to be present and shed light to some of the phenomenal work that we've been leading over the last several years. My name is Gilbert Johnson, and I'm a member of the RAC and also the Director of Strategic Reentry Initiatives with the Office of Mayor Karen Bass. And we're really good to be here and in solidarity with everyone. Thank you so much.
Thank you, Gilbert.
Hi, I just had a question. I'm sorry, I stepped out for a big part of the presentation, but um, I think I would like to know a little bit of like what the reentry looks like for especially when people are trying to have the reentry and housing at the same time. So I'm wondering like what are some resources out there that we can be oh
Continue forward with your question.
sorry, yes.
Yeah, please.
So yeah, I just wanted to know like what does that look like as well, like when it comes to housing support or job supports, um, what does that support look like, or are there any resources that you guys recommend checking out?
Yes, of course. There's a lot of reentry support. I know I have one of our members on here. Jack, are you able to speak? He's part of the St. John's Rice program that focuses on the reentry support. If you're able to speak, Jack?
Can you hear me?
Yes, we could hear you.
Good morning. Thank you for having me on. I appreciate it very much. So I am an employee at St. John's Community Health. As such, I am a program manager for the reentry department. Our department here at St. John's provides any and all services that we can for those exiting incarceration, county jails, or federal detention centers. We would like to identify what those services are, but we provide services based on the needs of the clients. So we do have workforce, we do have housing, we have case management, we have a medical facility here at St. John's that allows them to have access to medical, dental, vision, mental health. If they need their documentation in order to get benefits, we provide that. Anything under the roof of St. John's, we have immediate access to. Anything outside the walls of St. John's, our community health workers then go into the community and locate the service needed and provide it to that individual or individual should it be a family. Our job is to facilitate reentry into the community with as little as stress as possible and overcoming some of the 40,000 barriers associated with reentering the community after incarceration. And we try to base all our intake and services relating to the needs of that individual and what they are seeking specifically. If there's something particular you would like to know, I'm sure I can answer that as well.
Well, thank you so much. No, just that was my question. My name is Cynthia. I work, I'm a program coordinator at Eastside Leads. And then sometimes like we do have all kinds of folks, right, that we work with in our Stay House LA program that are always looking for housing. And so it'd be great just to know like a little bit from every program if there is any housing support available. What does that look like? How can we send folks? How can we be able to yeah, transfer over folks to resources regarding housing?
So St. John's has a housing component associated with the reentry program. Of course, there are qualifications that need to be met. We also have a workforce navigating program associated because there's no good use in providing housing should that individual no longer possess the capability to sustain that housing once we back out. So our goal is to provide all the social determinants of health that assist an individual to move forward in life in a positive manner while addressing all those needs that are interconnected in order to produce a productive existence.
Thank you so much, Jack, for all that wonderful information. And there is a lot of also other places and organizations and county services that do provide the reentry programs for folks that are coming in. The one that we're talking about is through LAJCOD, which is the justiceconnect.org. You can go online and connect with them for the housing department, and they're able to help.
And I think we added some of that information in the chat for those that are there. And of course, for those that are in the room with us, we will be producing a copy of the chat to be available on the website so people can find out these resources there. I just saw a hand from Monica.
So a couple of things. So one, when you're able to, you know how you have the statistics about the Black, Latino, I think it would be good to have LGBTQ, that statistic in there, because I think that just in general, that population is very underserved. And, you know, it's shocking to see how much, and I've known this regarding the Black, how it's like they're 8% of the population, but yet it's so high. I mean, it's high for the Latino, but it's really high for Black. And I'm sure that it's very, very high as well for the LGBTQ. And then as far as the housing stuff, I mean, you can also, everybody should be able to call 211, but people need to, in just general, they need to be connected to the coordinated entry system. They can do that through LASA, and it depends on where they live. An outreach team can go to them, but people can always call the housing authority. Not the housing authority, the Los Angeles Homeless Service Authority. I work for Exodus, so I know a little bit about the reentry, you know, and how we get clients through the reentry system. But again, there's not enough housing for everybody that's homeless. And then we also do have a team that's, you know, when people are coming out of jail that sits there and offers services, but it's up to the person to actually want those services as well. A lot of times they're like, they got out, I want to go home or I want to go somewhere, right? But yeah, so for the housing specific, just Google the Los Angeles Homeless Service Authority, and they should be services there. But 211 is also another option for people. I mean, it may not help you right away just because there's not a lot of, even though we're saying there is money, unfortunately, to provide services for everybody that needs it, we're just not there at this time.
Yes, thank you for sharing that. I agree. I agree. There's a lot of different ways of getting the support, and thank you for sharing the information. We'll definitely get it from you after this meeting. And to highlight on the LGBTQ community, as we mentioned earlier, there is no database. There's really no database. It's been really hard to actually get those percentages, and that's definitely something that we're going to be working on thoroughly. One of the challenges that can happen is, like, say that we create a survey, right? And we send it inside the county jails to find out how the conditions are for them, how their health and their security is. But the challenge is getting that survey in. Usually sheriff's department will block it out. So those are kind of like the things that we do face. We do face a lot of backlash and a lot of like roadblocks that the system puts on us, and we have to literally like advocate over that. So this is why right now Sergio actually is going to be leading an advocacy part of being able to highlight those percentages like on a database like this. Thank you.
And we also do, after our break, we're going to have a representative from the Care First Community Investment Fund, as well as from the Warm Landing Place, to talk about some of the services that are here. So you guys are helping us understand the problem and the challenges and the struggle. And then we'll hear from some of our county partners in terms of some of the response. Do we have additional questions for our Reentry Health Advisory Collaborative?
I just wanted to say something real quick. My name is Lamar LJ with the RAC, also with Homeboy Industries. I'm glad to see you guys. I wish I was there. I really do. Man, I was just sitting there, just feeling inspired, watch you guys present. This is what I do, man. It's a lot of passion and hard work, that goes into this work, for those of you that are also in the reentry space. Our communities have been, affected adversity for a long time. And, the RAC, we serve to try to clean up a lot of messes of mass incarceration and the crack epidemic and a lot of things that have ravaged, Los Angeles and our communities, so it's very, very much important work. Kudos to my colleagues who have done a great job presenting. Just know that this is important work. We're committed. We come from all walks of life, and as you mentioned, there's a lot of different demographics that are underrepresented, which is why we do what we do, right? We want to be able to present it and get those numbers to talk about, some of the other communities that are also affected by mass incarceration and some of the practices that continue to incarcerate, our folks today. So I just want to give a kudos, great job, guys. I wish I was there. I look forward to sharing space, and the work continues. The work continues. In the chat, I did share an additional rental assistance program for folks that are formerly incarcerated. So if you see the PDF, feel free to save it. Contact the guy, Dwayne. He's with another organization that does provide resources. They're doing great work, and so that's what we do, man. We come together, and we're essentially, working to undo a lot of the wrongs, right? And then the work continues because, just as we continue to climb mountains, there's a new one. There's always something that kind of positions and gets in the way of the community. So, so thanks. Appreciate you guys having us for presenting, and I'm pretty sure next time I'm around, you guys invite us again, and I'll be there. And I look forward to it. So kudos to inviting us, and kudos to my colleagues. You guys did a great job.
Hi, everyone. Rosa Soto. I'm with the Wellness Center in our foundation to LA General. I also am Supervisor Solis's representative on the Care First Community Investment Fund. And that particular body has advised on the allocation of close to 3 years of funding, close to 300 million. But there is so much work to be done. What I have learned in the process is that there's a lot of misunderstanding about what our reentry population needs. And so your voices are so essential. I want to also just invite you to continue to come back and work with us to figure out how do we close that gap? How do we improve the way people understand services that are needed for our reentry? Because I feel like often we focus on the immediate need, which is extremely important, but there's also the longer term support that is needed. And so we're continuing to work on that. Yesterday, we invited Homeboy Industries, I think it's their art arm, to come and present love letters. We had clinicians and physicians and, just our community here at LA General hear from the stories of our reentry partners and neighbors. And it was so inspiring because they share their story. And so, many of our clinicians were saying, we see the victim, we obviously know, that it's someone that needs immediate help. They are someone that we want to be here for. But when someone shares their story of, I came into this emergency room with, from a car accident, from being run over, from, an injury at a jail, whatever it was, right? And then and I was saved, but here's my story. It changes the way I think our hospital views our community, and we're neighbors and we're friends and we're people connected. And so that was really important. And so we want to continue to do that kind of work. And again, thank you guys so much for the work that you do.
Thank you so much. One of the things that I want to express is that the RAC, what we do is we implement all this solution making, right? So we come from a place of lived experience, like you said, and we look forward to continuing this work. And as we go, build sustainability to keep doing this work. So we would love to work with Ms. Solis. We do go to the Board of Supervisors and speak and advocate for everyone. And we would love to work closely to build and create a solution to make a more equitable and standard of what you said, the confusion of reentry, right? There's just because every individual person needs certain things. Not everyone needs the same thing. So to be able to have that heart and care to sit one-on-one and say, okay, what do you need? How can we help you? And be able to have those ready for them. I wish I can just pick everybody up and say, okay, here you go, and just start your life. Because as a formerly incarcerated woman that her kids were taken away, I had to start fresh, over 70,000 barriers. And this happened in the early 2000s, which means there was none of this help. So it was really hard. So with that being said, we're going to continue to do this work. Thank you.
Do we have any additional questions for our Reentry Health Advisory Collaborative members? Well, with that, I will say a very, very big thank you, a very warm welcome to sharing space with us here today at the Health Innovation Community Partnership. You truly are committed to health and committed to innovation and committed to partnership, which is what we're here for. So thank you so much for joining us and sharing your stories today. We appreciate it. We're so grateful again to have so many members of the Reentry Health Advisory Collaborative with us here today. But with that, we are very excited to continue our conversation about Care First, Jails Last initiative in LA County. And with that, I am delighted to welcome joining us today via Zoom. We have two members of the Care First Community Investment Fund and the Warm Landing Place initiatives. So Stephen, I'd love to have you kick it off. Please feel free to share screen and share your presentation with us. We're delighted to have you and Elizabeth with us today.
Sure. Thank you, Heather. Hello, everyone. My name is Steven Salazar Caesar, and I'm the Division Director for Community Capacity Building at JCOP. And I'm joined by my colleague, Elizabeth, and I'll let her intro herself while I get the slide going.
Good morning, everyone. My name is Elizabeth Gomez, and I am the Program Director for our site-based programming. And definitely will share with you about our Warm Landing Place once Stephen conducts his presentation. So thank you, Stephen. Nice to see you.
You too. Okay, so before I get started, I just wanted to recognize the previous presenters, the RAC, and the work that they do. So everything I'm about to talk about and everything Elizabeth's going to talk about, and kind of like the foundation of our department, is really due to the work of people like them, their work in particular, and also other organizers and advocates who have been pushing for decades for this kind of work. So I just wanted to shout them out and make sure they're recognized for their work. So again, my name is Steven, and I'm the Division Director of Community Capacity Building at JCOD, which means I manage all of our Care First community investment work and our JCOD Incubation Academy. So I'll be talking about both. And so JCOD, we like going over a little bit at top just because we're pretty new. So we've been in existence just under 2 years. And essentially our mission boils down to reimagining the way we do things in LA to be more person-focused and to create this collaborative system that surrounds people with care and help rather than incarceration. And by building this ecosystem of care that prioritizes small grassroots organizations that are providing the community-based solutions to mass incarceration that we know lead to better outcomes. And my division is essentially there to serve the organizations and make sure that they have the resources and support that they need, to be successful in carrying out their mission. And so a huge tool in the county's push for Care First is the Care First Community Investment, CFCI. And so if you all are aware of Measure J from a few years back, it was a ballot measure that passed a few years ago with over 50% of voters. And that funding is administered through what is called the Care First Community Investment. And that Measure J requires that the county allocate 10% of locally generated unrestricted funds to this work. And so that fluctuates year to year, but that's about $300 million a year in perpetuity going forward. And so that funding is managed by a 24-person advisory committee made up of community representatives, folks with lived experience, county department leaders, labor is represented, and they do a really excellent job in centering community in the process and actually bringing concept recommendations and program recommendations from the community and taking that and creating a spending plan that ends up being approved by the Board of Supervisors. And so some of that funding goes to county departments, and they fund a variety of programs that are operated through community-based organizations. So you could think about harm reduction programs, that we have a doula program. One of JCOD's programs, DOORS, which is the reentry, like site-based reentry program, which Elizabeth manages, is funded by CFCI. But a majority of those funds actually go directly to community-based orgs in the form of service grants or called care grants, which I'll get into in a bit. And again, I want to note that this is, funding that is now made available due to advocacy work and organizing that led to Measure J. And as such, it's designed and meant to, we have a public mandate at JCOD to use these funds to have direct community investment and to create alternatives to incarceration. And these programs are designed, to address the sustained disinvestment in Black and Brown communities, which are the communities that suffered most under mass incarceration. And so this work is all about investing in making Care First services available to people in those communities first. So I just wanted to stress that. Okay. And so here's a year-by-year breakdown of our care grants, which again are designed for small grassroots organizations. There's a priority place on organizations that have less than $1.5 million budgets, and it's all community reviewed. And so JCOD works with the Amity Foundation, who administers the grants, but they actually hire a huge roster of community reviewers who actually score the applications. So we're trying to sort of take the county and our perspective on things out of the equation in a way, and make sure that it's what is selected is actually what the community wants. And so our first year we had 118 grantees. That was from 700-ish applications. And we were awarded 55 million over 3 years. So that was the first round of grants. In the second year, we had 123 grantees. That was from 841 applications. And that was $122 million in grants over 3 years. Actually, I'm going to go back. And these photos are placed. These are actual grantees. This is Danielle Lafayette from United Nations, who has a housing program for women in reentry and also does youth programming at Dorsey. This is Reginald Laudermill, who is the director of Inglewood Wrapping Arms Around Community. They do some youth programming in Inglewood as well as reentry housing. And here in year 3, which we just celebrated yesterday, we have 163 grantees, and that's 175 million over 3 years. So this is like a massive, massive investment. These folks are from transitional living homes in Long Beach, and they do amazing work of housing anybody who needs a home. And as you know, some of you may know, it's very difficult to house particular segments of the reentry population, in particular, folks with previous convictions of arson, or if they're registrants. But transformational living homes does incredible work of housing anybody who needs a place, and so we work with them on this as well. And then just like, you know, for some perspective, again, we have, you know, hundreds of grantees. It's over $350 million in grants at this point. And here's this picture. This is last year's luncheon. We just did one of these yesterday, but this just represents one set of grants. And as you can see, it represents Los Angeles. These grantees are all over the county. They work from prevention and youth programming to reentry to housing. It runs the whole gamut, and it's totally flipping on its head who we fund at the county level, and how we support them. And so before I talk about Incubation Academy really quick, some lessons learned on this. You know, this is, again, designed for small grassroots organizations. And if, you know, we at the county understand that if we're going to switch up how we fund folks and we focus on these grassroots orgs that are typically like functionally locked out of funding because of how difficult it is to win a county contract, then we have to meet them with support, right? So there's a huge need for unrestricted funds. These organizations, often this is their first grant, so they don't have money to buy beds for their housing program necessarily, or, you know, wrestling mats for their wrestling program. They need this sort of unrestricted support that other organizations might have through philanthropy. And these folks are stuck without that kind of support beyond this grant. So we're working towards building out a fund for that. And there's a huge need for technical assistance. Again, you know, going from little to no funding to having hundreds of thousands of dollars or $1 million plus in a grant requires a lot of administrative understanding of how the business part of nonprofits are run. And so we're working to meet them with that kind of support too, so that they're able to deliver on the services they know how to do. And we want to support them on the back end nonprofit management pieces as well, which is what I'll talk about in a second. And then another thing is, you know, we really view these grants as not just a service grant where we're hiring them to provide a service to residents of LA County. It's very much a capacity building grant also, in the sense of this is the first time often that these folks are getting paid for their work, first time they're able to hire staff, first time they're able to really have this proof of concept that they could then go and raise other money or win other contracts and sort of grow their organization. And so because of that, we can't treat it as up and down, like we pay you, you do this, and that's what happens. That's what typically our contracts are at the county level. Here, we're very much interested in their growth and their, you know, sustainability as an organization, because we want to work with them going forward. And so I'm probably over time, so I'm going to go real quick on the Incubation Academy. We have a program for nonprofits where we train the leaders on how to manage their nonprofit. It's all based on nonprofit management best practices. We provide peer mentoring, advising, and resources. It's a training program that is tailored to these small organizations who need the support on that back end, like I was talking about. So we've done 6 cohorts so far. We have nearly 140 organizations. And these two processes are separate. They don't get a leg up in the CFCI grant process, but our organizations have won $55 million of CFCI funds. Overall, they've reached $75 million in grants and contracts in the 3 years we've been working together. And so we're very lucky in LA County that we're able to meet this need with this funds and also have these sort of training programs that support them at the same time. And I don't know, Maria is still in the room over there, but Maria from Pride and Truth actually participated in the Incubation Academy. And we're very lucky to have leaders like her that we get to work with and get to support. And it's very much the reason why I love my job and the reason why JCOT exists is to support people like her. Yeah, and I'll leave this and I'll share this slides, but I'm hoping you all could fan this out to your networks. We have a rolling application, meaning once you apply, you're constantly under consideration for the next cohort. I don't have it up here, but the next deadline for our January cohort is November 1st. But again, if you get it in after that, that just means you're up for the next one in the spring. So yeah, that concludes my presentation. And I don't know if we're holding for questions or I'll pass it over to Elizabeth.
Thank you so much, Stephen. Let's take a little moment for questions if anyone has a question for Stephen about the CFCI initiative. Questions in person. I don't see any hands leaping up. Elijah, do we see any questions in the chat that we want to respond to? Any raised hands? Okay, you did a thorough job, Stephen. You answered all the questions in advance. With that,
cool.
We'll turn it over to Elizabeth.
Thank you so much, Stephen. Great job with presenting all of the great work our community-based organizations are doing. Will someone bring up the slide? I sent it over.
Would you prefer to run them yourself, Elizabeth, or we can do it? I'm so sorry.
I can do it, Elizabeth, if you like. Just give me
Sure.
1 second.
Thank you so much. That'll work. Thank you.
Mm-hmm.
Good teamwork. So as Stephen is bringing up the presentation, again, my name is Elizabeth Gomez. I am very new to this project. Prior to me coming along and working on this project, I would like to give knowledge and introduce Yelena Skiba, who definitely created this presentation, and she had a lot of input and a lot of work towards this program, which is Warm Landing Place. So Yelena, if you have a quick minute, if you can just kind of quickly introduce yourself.
Hi, everyone. Yelena Skiba with LA County JCOD. Happy to be here. Thanks so much for having us. And, I'll let Elizabeth take on the presentation. If you have any questions, we'll be happy to answer. Thanks so much.
Thank you, Yelena. Okay, we can move on to the next slide, Stephen. Thank you. All right, so I'm here to tell you a little bit more about our program, which is Warm Landing Place. Warm Landing Place is a rapid reentry program, but before I go into kind of the meat and potatoes of this training and information, I would like to share a little bit of background and context in terms of our county jail system. We know that our county jail system is one of the largest in the nation. And as of May of 2024, there were 12,571 individuals in LA County jails. Every day, we know that hundreds of individuals are being released from LA County jail system without having stable housing options and lack of basic services. Therefore, in the Care First Jail Last spirit, JCOD really worked on finding out how can we support folks that are coming out of the carceral system. And so we talked about Warm Landing Place, and it's a new LA County program that engages individuals immediately upon release from the downtown Los Angeles jails. And we provide them with immediate same-day services and additional services and linkages. Some of the immediate services that we provide when folks are coming out of LA County jail system is snack, water, set of clean clothing. We know that sometimes they're released and they have to walk around the streets with a jumper. And we also provide supportive services such as referrals, free transportation within the county, and short-term bridge housing. Some additional services that we provide are linkages to social and support services, linkages to permanent housing options, and connection with mental health and substance use disorder services. We do offer reentry support services. JCOD has a plethora of services, such as our reentry intensive case management services. We also have programs, as Stephen mentioned earlier, which is our DOORS program, which is developing opportunities and offering reentry solutions. And all of these services are meant to really connect folks so that we can reduce some of the barriers that they face when they're exiting the carceral system. Next slide, Stephen. All right, so warm landing place. Well, what is it? So I can tell you that we've been working very closely with Los Angeles Sheriff's Department, and it's an inmate reception center at the point of exit where someone who's coming out of Twin Towers or Men's Central, they usually come out through the inmate release center. And we were fortunate enough to build a collaboration where we have a table outside in the waiting area where folks can obtain information and really access all of our services. We did a soft launch on January 10th of 2024, and we're very happy to say that having this table there and having resources and staffing there to really help folks navigate their exit has been proven to be very successful. We do have 3 phases to this project for Warm Landing Place. The first one was, as I mentioned, to have the table outside of the waiting area. The second phase would be to have an RV, and I'll during my slide, I'll share a little bit more about the RV and where it's going to be located. And then finally, the third phase will be to have a physical location where we can definitely provide services, but that's more of a long-term solution to help folks that are being released. So just to tell you a little bit more, when folks are exiting IRC, which is the Inmate Release Center, they come to our table and they ask questions. But we also found out that at times folks are eager to get out of that facility, and sometimes they may just walk by our table. And we found that family members that are in the waiting area waiting for their family to come out, while they're waiting, they're also getting information about support services that we offer, because JCOD offers services not only to the justice impacted individual, but also their families. So we found that having that table there and access to resources is beneficial to the families and the community to learn more about the services and resources that are available in our community. So that's a good thing. So what happens to folks when they walk past our table and they don't access resources because they're so eager to get out of the facility? We have another area where outside of the facility, we continue to engage folks, and we find that they're a little bit more receptive to hearing about the programs and services that are available, particularly, providing them with transportation to get wherever it is that they need to go to. We provide them snacks, we provide them with water, and as I mentioned earlier, we also provide clothing if they need it, and any other resources that they may need. Next slide, Stephen. So this is an aerial view of where Men's Central Jail is. And I wanted to point out that where you see the number 2, there's a community park there that we are working very closely with the Los Angeles Sheriff's Department. And our hope is to reimagine this park. The Sheriff's Department is very committed to beautifying this area where you see the number 2. And our hope is to make it beautiful, plant flowers, and really make it a welcoming environment for folks, and where we could continue to do outreach in that area. Again, you know, the revitalization of this park is going to really help us engage folks that are coming out of Twin Towers and Men's Central, and really engage them in a way that, you know, it's trauma informed, and be sensitive to folks that are coming out. Next slide. So this is another view. This side really shows you the amount of distance from when folks are coming out of the carceral system. And this is where you see number 2 is another view of the park where we really want to beautify that area and make sure that we catch folks. If we didn't catch them, you know, in the waiting area or the lobby, that hopefully we can engage with them and in the second area, and really be able to provide them with information and services, you know, in a space that it's not so confined. So we wanted to share that with you all. Next slide. So as I mentioned, Warm Landing Place is a project, but within the project, we have 3 separate little projects. And the first one was, again, you know, to be in the community area and the waiting area. The second phase is for us to really place an RV outside of the facility. And this is a picture that kind of gives you an idea as to where the RV is going to be located. And again, I want to emphasize the relationship that we have with the LA County Sheriff's Department, because they've been instrumental in really supporting this project and ensuring that folks get the resources that they need. And one way that they've done that is that they're going to help us add lighting and cameras to increase safety for the entire community as a whole, because we know that folks come out at different times of the day or night, and we really want to have you know, enough lighting, enough presence, and be able to support the community and the staff that are going to be there. Also, you know, we want to be able to provide these immediate services, and we think that the RV is really going to help our folks, you know, protect them from the ailments. We know that right now it's really hot out there, or it could get very cold. So we want to have a space where folks can come in, have a little bit of privacy, and have their needs met. So we hope to have this RV in place sometime around the holidays. We're still working on it, so we're diligently working on trying to get this up and running. Okay, next slide. All right, so again, you know, I mentioned that the rollout plan, we had 3 phases. The third phase that I wanted to share with you is that we are planning to have a location that's very near Men's Central Jail. And we are going to dedicate 29 bed facility and case management lease space. So we're very excited about that. This is going to be short-term housing. It's not going to be long-term housing. So the goal is that when someone is released from Men's Central Jail, that they can go into a place, if they don't have anywhere to go, that they can go into a place for up to 7 nights and then transition into another facility, and gives us time to really connect and build those bridges so that folks don't become unhoused. We are leasing a space which is about 1.5 miles away from the jail. And again, we do provide transportation for folks. And we expect for this site to be open sometime late 2024, early 2025. Next slide. So as I mentioned, the third phase is for us to have our own physical space where folks coming out of Men's Central Jail can go into short-term housing. This is the front view of the space that we've already acquired. It's very near Men's Central Jail, and in the next slide, I'll show you an aerial view as to how close it is to Men's Central Jail. We've already purchased this this building. It is within walking distance of Twin Towers. And we're actually trying to figure out how we're going to move forward with the planning phases to begin construction on this site. Next slide. So as I mentioned earlier, Twin Towers, this is an aerial view, and on the bottom right-hand side, you could barely see it, but there's a name that says always bail bond right to the left-hand side of this picture. And that's where our physical location will be, where we purchased our building. So it's very close, it's within walking distance, and we hope that, you know, that'll alleviate some of the housing situations for folks that have nowhere to go and will need like a short-term transition from the carceral system into society. So it's very close, and we're very excited about this project. Next slide. So this last slide is just information, and it gives you a picture of our table inside of the waiting area and where it's located. And also on the left-hand side is all of our dedicated staff who have worked on Warm Landing Place, including our leadership. Yelena is on there, and that's where we are every day, trying to engage folks and really linking them to services so that they can have the supports that they need. Just to share some quick numbers for the first 4 months since inception of Warm Landing Place, we've provided unique encounters to 1,291 folks. 946 were justice involved individuals and 345 were family. As I mentioned, a lot of families do tend up going up to our table and getting additional information, which is great. And then we've done 48 housing placements, 362 free transportation arrangements. And then we've given out t-shirts and clothing items as well. So we're very excited about this program. Definitely there's more to be done, but I think we're in the right path in terms of providing care first and jails last. So that would conclude my Warm Landing presentation. Thank you all for your time and really helping us spread the word about this service, and we're excited to share the information.
Thank you so much. I do have a question for you from the chat, Elizabeth. Is the Warm Landing Place facility for men or only for men, or for men and women, both?
So because we are placed at Men's Central Jail, you know, the majority of folks coming out from the inmate release center are men. So I would say we target primarily men. However, you know, if we have families that are there in the waiting area and need resources or services, we'll definitely link them up to other services. We have our reentry intensive case management services, which provide services to men and women. They also have, you know, interim housing resources. So regardless of who's coming up to us at the table, we'll provide them with resources and information that are you know, beneficial to each individual person.
Thank you so much. And we also
Yeah.
have a hand raised. Vivian, would you like to ask your question? Sorry, Vivian, it's not coming through clearly.
Can you
Please
hear me
feel
now?
free to, it's better now.
Okay, thank you very much.
Okay, perfect. Hi, Vivian.
Yes, hello. Hi, thank you very much. I'm really excited about this whole program as I also have a new business for electric vehicles, and we were or we're going to be looking into high, especially women, because we are always treated secondly, and wanting to hire well as women who've been incarcerated. But like my concern is again, women have in line, and I know that women are much more vulnerable, and so that's really what my concern is there, especially women with children wanting to come back home, trying to get a job, looking for everything for men. I'd like to know how soon is this going to be taking place for women? As women, we are not really front end line. We're always second. So if you can actually enlighten me something that's going to be parallel to this taking place. Thank you.
Thank you, Vivian, for that. We can definitely, bring back this information to our leadership team. Currently, we do not have a program that, is very similar to this. But maybe Yelena can add some information. Yelena, do you have additional input regarding this?
So this is our first pilot. We're very excited that we were able to pull this program together at Twin Towers MCJ, which does house majority men, and there's also LGBTQ population part of MCJ. So that is our focus. And Linwood Jail for Women, if that's what you're referring to, is it has been brought up as potential expansion of the program, and we would love to explore that further. But at this time, this is our first pilot. So I know that there's a lot more services needed, and um, the goal is to provide as much as we possibly can. But we're so excited to be here and doing the work that we're actually doing now. So I think it's a good direction to explore. So we welcome more feedback
Yeah.
from everybody.
Thank you, Yelena. And also to add, we do have a JCOD funded program geared towards women, and it's called Power, providing opportunities for women in reentry. I did put our JCOD website information on the chat, so you're welcome to go into our website and really explore other resources that we have available, because as you mentioned, women do need resources as well. It may not be warm landing place, but there are comprehensive services that we're offering to women, and that is one of them. So I would encourage you to go to our website, really look and see what services, are appropriate, and reach out to the appropriate people. Thank you.
Elizabeth, we have a question in the room from Monica.
Hi, so a couple of things. As far as what organizations are you working with for safe landing? And then is it just one organization? Is it several organizations for this? Also, you talked about the relationship that you have with the sheriffs. I think that it would be more beneficial to be inside, to have a table inside when people before, maybe like a week before they're getting out so that they understand the program. We know that just before you had the presentation, we were talking about how people are eager to leave and may not be able to get services. So if they're able to, if they're told before the kind of services and explained to them, that would be a better way to reach that population, not, as well. Like, I mean, a better way to connect with that population is what I'm trying to say. That if you do it from inside the jails as well, right? Because they have a little bit more time to think about what they want to do when they come out. And then also, we just want to make sure is as far as funding, how much funding um, is being put into this, and then how is it really reaching the ground floor, right? Or do you have to put like more? Are you is the goal to put more of these tables at other locations besides the women's jail?
So, to answer your question, thank you. Those are some really great questions. In terms of organizations that we work with, we do work with community-based organizations. I don't have the specific names of them right now, but I know that we do work with DMH also. DMH provides services while folks are in the carceral system to provide education and resources. So that's something that we currently have in place. And in terms of funding, I don't have that information for you currently, but our goal is to move forward with this pilot project, which we're gonna probably have a lot of lessons learned and pivot and really make it more effective. But currently, we do not have plans to expand into other areas. I think I answered most of the questions, but if I didn't, please let me know.
So yeah, Monica's comment is that to have that integration to be inside the walls of the jail before people leave, to just make sure that that connection is really made. I think that was the comment.
Okay, we can take that. We can certainly take that back and figure out, how to incorporate that if possible. But those are some really great points. Appreciate it.
And we're going to take our last question from the room right now. I invite Maria to ask her question.
Yes, thank you so much. First and foremost, I want to say hi to Stephen. It's been a pleasure,
Hey.
working with you. Thank
Good
you.
seeing you.
My question is, as a constituent, as a resident, as a people, right, leading to the winning of Measure J. This happened back in 2020. I worked very closely with Eunice Hernandez at the time to making sure that this happened, and also following the transition of where the funding went, right? The opening of JCOD, the transition of the ATI program from LISC to JCOD. There has been a lot of confusion in the communities of like where this is leading. I just wanted to emphasize that I'm glad that you guys are creating these programs where it's starting to come clear for the community on how to get these services. But I really, really would like to implement that you really focus on the community-based organizations that are grassrooted, that are in the community, what I call boots on the ground, creating this work and making sure that the communities have what they need. A lot of organizations are confused and they really don't have the direction that they need. So if you implement these organizations into this program, it would be a lot easier for the communities to have the services that they need at hand. Also, earlier it was mentioned about the integration part of the Sheriff's Department allowing us to come in and prepare these folks that are coming home into reentry with a roadmap and guidance into coming into back into society. That was actually one of the recommendations that was in the 114th Care First Jail Last recommendations. So I just really hope that JCOD really brings that support, and once the Sheriff's Department actually allow us to participate and help with this barriers that are actually in place right now and remove those barriers, I think LA County would have a lot of better ways of having support. Thank you.
Agreed, Maria. Thank you. Thank you for that. And to answer your question, JCOD does contract with community-based organizations. As Stephen did his presentation, he mentioned, us working with 300 community-based organizations that are grassroots, that are on the, smaller end, and where we provide technical assistance and support. And so we do have that in mind, and we continue working with our community-based organizations. And to your point in terms of the roadmap, definitely we'll bring this up and see how we can incorporate that at any point. based on the relationship that we have with the Los Angeles Sheriff's Department. And I know that Stephen took himself out of mute, so I'll let him kind of jump in and piggyback and share his thoughts.
Yeah, thank you, Maria. Yeah, to your point, we're doing a lot of great work and we're contracting with the small grassroots orgs and really making sure that it's community based and community solutions to this. But to your point, we haven't done a good enough job of communicating what's been done and what's happening to folks. And so that's something that we work on with the CFCI committee, and we're going to be, outlining a plan to make sure that we're getting out there and showing people who might be able to use these services, what's available now in their communities. And then for you all who led the work to create the funding and guided the recommendations, for you all to see that we're following what was set forth and that it's remaining within the spirit of CFCI. So yeah, point taken, and it's something we're building towards. Another thing I'll note is that we're starting a program review process for CFCI where the CFCI committee designed a program review tool, which will be used to sort of go and see what programs need support and how we might be able to, add additional resources to support them in succeeding in what they set out to do. But yeah, thank you so much for your input.
Thank you, Stephen. Much love.
I thank our presenters for joining us today. We are going to conclude this section of our meeting. We have one final presentation. I think we have yet to kind of get the sweet spot of being back in person and making sure we keep our presentations running on time. But thank you so much, Stephen and Elizabeth, for joining us remotely and for sharing with us the wonderful efforts that are being made collectively with our Resident Health Advisory Council and others to ensure more justice filled and improved approach to dealing with the reentry population. With that, we're going to move on to our lovely partners from Centennial. Prime Store is going to give us some updates on what's happening on the campus.
Good morning, everyone. Thank you for having us. My name is Giovanna Araújo. I am project manager for the General Hospital and West Campus Revitalization. I'm also a first generation Brazilian immigrant. And I'm a trained architect with a focus on social and environmental justice in our built environment. So this is a project that's very near and dear to me and to our team. We are very well represented on various fronts of this community. And I'm here with Leandro Tyberg, our president.
Buenos días, gracias a todos que están aquí. Me da mucho orgullo de estar aquí adelante de ustedes. My name is Leandro Tyberg. I'm president and co-founder of Prime Store. We started the company 32 years ago in the summer of the aftermath of the civil unrest of 1992. At a time when Los Angeles was hurting, there was a lot of pain, a lot of tears, and a lot of need to find different ways to redevelop our communities in a much more sensitive and intentional way. I was born in Argentina, in a city not far from the border of Brazil, so it's appropriate that we are adjacent at all times, and we are not allowed to talk about football at all. We don't want any arguments. We are also joined today by Claudia Cardenas, who's our Director of Community Outreach. She's at our little mini booth in the back. Claudia has been working with me for almost 29 years. I'm not allowed to say exactly. She started when she was 5 at the company. And she was actually born at LA County General Hospital, as was many of our staff. We are LA based. This is home. This is a very personal responsibility and a responsibility that we take extremely, extremely seriously. We view ourselves as your development partner, and that everything that we do is going to be done in collaboration and in communication and in solidarity with the community. That is where our heart is. Those are the things that we believe in, and that is what we have been doing for 32 years. We do not do luxury projects. We only focus on communities of underserved areas, and that is the way it has always been and always will be. So this is extremely personal, as Giovanna said. A little bit about our values. We are the collection of our beliefs. We are the collection of our intentions. We are the collection of what we want to see in the world. Most importantly, we believe in honesty, integrity, and doing things in a way that uplifts our communities that we love. The work that we do does impact people's lives, and we have to be extremely sensitive to that. We've had the blessing of creating and cultivating a beautiful partnership with the Wellness Center and HICP. I believe this is our fourth time being invited, and we will be doing so hopefully forever as your community partner. And we have begun an incredibly robust process of outreach that we're going to talk about today, along with technical studies that Giovanna will illustrate. And we are going nowhere. So we will be here before meetings, after meetings. We have the blessing now of having an office in El General. So you can come visit us. And our approach is ongoing openness and collaboration.
Yes, thank you, Leandro. And we're working right now on a 3-phase process. Right now, we're in phase 1, which is a project definition phase. There are many ideas and visions that this community has already shared over the course of the past few years through very robust engagement. And our job now is to really absorb all of that information and translate it to, alongside the community, projects, things that are going to be responding to those needs and those desires. So in this phase, we're doing all of our takeaways from these feasibility studies that have occurred to date. We're also identifying any information gaps or documentation gaps for any technical studies that need to happen on a structural level, right? For all of the buildings that would need to be renovated, really understanding the site. So as we identify those gaps, we're also creating any additional information that's necessary to get us answers and get everything prepared for the moment where alongside the community, we identify what programs are going to happen on this campus, and we're ready to begin and implement. In this process, we're also looking at those various needs and assessments and putting together a process of engaging with the community. And that process would be, okay, we've read all of this information, we understood all of this information. Are we correct in all of the assessments that we're making? How can we build upon the information that has already been shared with us as far as your needs? And how can we work together and collaborate to assess where we're headed in the future? In this phase 2 process, once we go into phase 2, now is the moment that we're actually making any kind of recommendations alongside you about what should happen. And we're creating actual projects and phasing plans for that and thinking about what kinds of systems need to be set up in order to deploy these projects. And in phase 3, that's when we go into the more complex entitlements and agreements to deploy ideas. Again, in the spirit of advancing previous initiatives, right? This is an effort that it has 3 pillars to it. There's a community and input and needs, there's county requirements, and there's also technical considerations. This is a process that has already been ongoing in this format, and originally a process that was informing a framework, meaning ideas and visions for the needs and desires of this project. Now it's a process that would be informing action plan. So this is a process now of executing on those ideas. So for technical considerations, conditions, constraints, and opportunities on a physical environment level, for community inputs and needs, really understanding what are some of the challenges that these communities are facing and their priorities. And for county requirements, really understanding what are some regulatory things that we can leverage as opportunities to make sure that these things get implemented. Also, everything absorbing the perspectives of our surrounding communities, LA County, and the medical center. Anything you want to add here, Leandro?
There's one thing I would like to address. Jasmine in the chat posed a question which I think is really worth listening to, which, she wrote, "Do you believe in putting the livelihood of people before profits?" That's a very important question. I think the answer is absolutely. But I also think that we have to define profit in very different ways. We want a project to be ultimately developed here with the community input and with community intentionality. We believe in investment and we believe in wealth creation within the community. So profit can also be defined as people having, social justice, affordable housing, stable jobs, living wage jobs, union support. There's all different forms of profit beyond just what we make out of it. If we were only interested in profit, this would not be the next 10 years of our life's choice of what we choose to do with it. So even though we are a for-profit company, there's an incredible amount of intentionality in that we believe that having the ability to do multiple uses, multiple different kinds of investment, it's the optimum way that we can actually achieve something together.
Thank you, Leandro. Yeah, and another thing to point out about this three-pillar process is that we really come on as partners. Our job here is to be held accountable to implement on all of the visions and priorities that are derived of this three-pillar process. So that's something that we're really looking forward to working with you to do. It's an important opportunity to go past just ideas and get something really beautiful happening here on this campus. So already through this process, we are hearing community priorities that we're learning from these previous studies that have occurred alongside this community. Here are some themes that are showing up as we're having conversations with individual groups, which Leandro is going to dive into a little bit more detail about momentarily. But a priority for the community being affordable housing and affordable housing spectrum that really includes families, senior living, workforce housing, that allows for this to be a community that's really diverse and that can tap into various resources and support for one another. Economic anchors, so job creation, local businesses, workforce training, community spaces for education, commemorative spaces, cultural spaces, open spaces such as parks, supportive services from health support services and also social and as well as technology, so folks can navigate application processes and really be able to access all of the wealth of services that would be provided on this campus. And then neighborhood accessibility, sustainability and resilience, really being able to connect to everything that is beyond this campus around this region, and doing so in a way that, thinks about transportation, walkability, and makes this a very accessible location.
I think the one thing that I would add is we're going to go through a process of really talking about ultimately trade-offs and really working with the community on dialoguing about how to toggle certain parts up and certain parts down. What does the community want to see in regards to full spectrum of housing services? Which parts of affordability levels are the most important to the community? How much should we be focusing on land trusts as well as home ownership options, and really try to understand the best way to navigate forward based on not us asking you, what do you want to see here? But us coming to you to say, this is what we've heard. How much do we dial it up and how much do we dial it down? ¿Se llama Yolanda? Perdón. Mónica, I'm sorry.
Let's say, so I'm kind of frustrated, and maybe just because I get frustrated really easy. Um, so the time frame that you have in the beginning, why is it so long to analyze like the feasibility study? I can tell you what the feasibility study says, right? The other thing, why are you talking about home ownership if we know that nobody can own any of the property that we're building? So that's going to confuse it, right?
Let me offer the last one first, and then you can talk about the.
Because I just let me go back, because I feel like we should be going out into the community. Like we've, and I said this at the last meeting that and it just scares me because we know as far as the housing part, we've talked about very, very low, like, because we know affordable housing isn't what affordable housing was before. It's who is it affordable for, right? So, and I think we need to go out in the community. It just seems that it's taking too long. That's all I'm saying.
On the issue specifically related to the word homeownership, our job is to study all of the options available. One of them would be potential home ownership, wealth creation opportunities through equity. The other is through land trusts. We do not yet know how that would be implemented, but it's one of the options that we ought to study based on the community input that we've heard. So we actually heard that from the feasibility study and from the groups that we've spoken with.
You can't own you can't own it. So I don't understand that. That's where I'm getting confused. And because it's county property, you cannot buy it, right?
The mechanism for doing that is something I don't yet know how to do. So the question is, we must study it to see if that is a feasible option.
Yes, yes. And to speak to this phase one, feasibility studies assessment is one aspect of that. And there's also additional studies that need to happen. And in observing those three pillars, there is a process of negotiations and mutual education and understanding that happens to make sure that all the stakeholders and the committee members within those three pillars have had an opportunity to give their input into anything that is being recommended. So that is a process that does, take a certain period. It's less than a year, right? We've kicked off in July, and we're estimating that we'll go through May. But also, once there is consensus on those recommendations, there is a 2-month period there where we also need to be working with county to make sure that all of those recommendations have been put into paper and that there is agreements that are put in place so that we can move forward on to the next phases. So it's just a multi-step process of not only looking at the feasibility studies, but setting up all of the legal background to make sure that now we can take action on it. So to speak a little bit about our engagement process, how we're envisioning that we'll be working together with community, and also to touch on some things that we're already doing. We're having informal discussions where we're having an opportunity to connect with folks who reach out to us and who reach out to them on a one-on-one basis. We're also having group meetings with community stakeholders and also campus stakeholders, which Leandro will go into a little bit more detail about, that allow for us to really bounce back any thoughts and gain more in-depth insights on a very personal level. Those two processes are informing our planning for community at large meetings, which we'll be announcing soon, and that will give an opportunity for everyone to then be involved and chime in. So these smaller groups are really helping us refine all of that information and prepare to have these conversations in a large forum. We're also participating in existing forums, so HICP being one of them. We'll be giving presentations in the future at the General Hospital Town Hall. And pop-up event participation, when there is an event on campus, like the farmers market or the staff wellness event, we are also having booths there and making sure that we're giving an opportunity for folks throughout the campus to interface with us.
We want to stress that anybody that wants to meet with us, we welcome it. Of course, we are outreaching to over 40 different groups within the community aggressively now to try to meet as soon as possible. And we really want those one-on-one or group meetings to occur before we do a general public meeting so that we can really start to build that dialogue and trust and understand exactly not just what to look for, but what to avoid. So we are very much in listening mode. I will also say that the people that you are speaking with, Claudia, myself, Giovanna, David, who is here also, we are ultimately the decision makers at the company. And so what you say does affect us very, very deeply and very, very personally. One of the things that we want to do as we report back on a monthly basis here with our partners at Wellness Center and HICP is talk a little bit about what we've been doing over the last 30 days, talk about what we're going to do over the next 30 days. Over the last 30 days, as a part of the listening mode, we've been listening a lot. I know it sounds repetitive, but we've been having booths. We've been participating whenever we can in events with the Wellness Center and HICP. We've been a part of the town halls on the Wednesday morning calls. We have our bi-weekly meetings here at the hospital with our partners at the Wellness Center. And we're also meeting with as many of the county stakeholder departments who have facilities, programs, utilities, parking, all of the needs that are underground, above ground. This is like a telaraña, like a spider web when you pull on one part of the campus and it moves another part of the campus. If you just try to dig a hole, you're going to hit something. And so we have to be really, really sensitive about making sure that we really understand what's here. And there's thousands and thousands and thousands of plans and pages to go through as we create a 3D model in computer Revit and Rhino to ultimately really be able to understand what this whole campus looks like.
Yes, and in the spirit of keeping this group in the loop as far as our activities in the coming 30 days, we'll also, as I mentioned, begin planning our community at large events. We'll continue to host these meetings and meet with smaller groups, host booths at meetings and meeting with smaller groups. We'll be presenting at the LA General Virtual Town Hall. And next week, we'll be at the National Hispanic Heritage Month Community Health Fair. And to talk a little bit about our technical studies, because I know they can be very abstract, like what are we actually doing when it comes to understanding what's going on currently physically from a structure standpoint on the campus. Our architects are conducting on-site verification of floor plans and drawings that are as built. So they're looking back at drawings from the years when the hospital was first built and other buildings on the campus were first built, and walking around the campus and looking at opening doors and looking through each and every room, each and every crevice to make sure that those drawings are accurate, because that's really what's going to allow us to then make any improvements to these structures. They're also visiting with various groups and that are currently on the campus and really understanding how everyone is occupying these spaces. How do we make sure that disruption is not something that will be significant, and that we really observe continuity of operations when it comes the time a few years from now where there will be construction throughout the campus, that we're considering and really honoring and pushing forward all of the spaces and the services that are so invaluable to all of the staff and the users of this campus. Our engineers, they're looking at structural conditions of the pharmacy, the general hospital, the historical tunnel, and really understanding and assessing how everything is and what kinds of seismic retrofits are going to be necessary, to which extent, so that not only we're thinking about programming, but we're thinking about safety for occupants. We don't want to, the goal is not to just get everyone in here and not have a beautiful, safe shell, right? This is also first and foremost in this process. And then our mechanical, electrical, and plumbing engineers, as well as our civil engineers, are looking at all existing equipment, everything that is sourcing power and water to the various buildings on the campus, and looking for opportunities for sustainability and for improvements that can happen even more immediately for users. And then in the next 30 days, you might notice us on site doing some additional studies like geotechnical studies on the campus, and also some materials testing. So this is an information gap that we've identified that's going to be really necessary to make sure that these spaces are safe. And then also to circle back on this, we have an office at General Hospital now. So we welcome your visitations. We welcome this as a space to give an opportunity for connection. We are here multiple days of the week, and we're definitely available on Fridays between 3 to 5 p.m. We would be expecting that's a window where folks can stop by and have a conversation with us and voice any concerns that they have or any ideas that they have. So if you'd like to schedule a time to speak with us, we're making our contact information available. Okay, here's our team on campus, our various teams doing site visits. And thank you very much. We appreciate your time and we welcome any questions.
Hi, good morning. If you could go back to the slide where it has the different little symbols going across it. One of the things that I'm noticing on here, you mentioned that you'd be meeting with other groups and so on. One more, I think. There. So some of these things that you're going to need to study, I believe, are being studied by other projects on the campus. So I just want to make sure that you put it on your to-do, that you connect with several of the other building projects, including that big one across the street. What's that called? The supportive housing, public transit, parking, walkability, all that thing. I think they're doing studies on that. And I would hate to have, 3 different projects working in silos and you didn't coordinate the transportation. It's an easy thing, I think, to do that if you don't do it. And so ditto with the other goals. It's really just collaborating, or rather being aware of what they're doing so that we can leverage it. And at some point, the community engagement might have to do a little bit of that as well.
It's Ari,
Thank
right?
you, Ari.
Yeah. We think you're 100% correct on that. We actually had the blessing of meeting with Public Works yesterday to go over the restorative care villages, the first phases. We have a beautiful meeting with Alex coming up. We've already met with Medical Center and many others. Our ultimate dream is that this is a cohesive wellness campus that is thoughtfully done all the way through. The worst thing that we would want to see is fences between the projects. This has to be one cohesive campus based on wellness. So we really think that you're right on about that.
And I think we have one final question from Vivian in the Zoom room. Vivian, would you like to ask your question?
Yes, thank you very much. I'm the CEO of Boyle Heights Community Partners, and I'm actually very excited that you are actually there. I know that in our community, seniors are extremely vulnerable. They're hard to reach. They're living unsatisfied living conditions, and I know that it's very difficult. I know we have many, many senior citizens and senior centers that I seriously hope that you will actually priority, as well as people with disabilities and our veterans. I feel again these they are treated more as second to any kind of housing that's actually available. Sure that I give that input because it's a very, very sensitive issue with me for all 3 all of your work, and I'm glad that everybody's working together on all of this, as there is a lot of research and a lot of groups and organizations in this. So thank you very much.
Thank you, Vivian, and we respect your comments. It is something that you uplifted in the last HICP meeting that we noted. We have the blessing of currently working on 5 other affordable housing projects, 3 of which are 100% for veterans and for seniors. So it is something that we strongly believe in, multi-generational housing and mapping all of those uses together is something we feel really is an ideal spectrum for the community. So we very much agree with you.
Thank you very much. And also, it would also be beneficial to also make it accessible for many others that Heights that are feeling the restrictions of the categories of not qualifying income. I think that the curve might also be considered so that we can act people coming in back into our returning to our communities that are at different income levels.
Yes, thank you so much, Vivian. We definitely appreciate your comments, and I think you are not alone in making those identifications as to the economic needs of the community. We have one final question from Katrina. Thank you so much, everyone, for sticking with us a little past our time. But Katrina, please ask your question.
Yeah, sorry, I'll try to make this quick. Thank you all for presenting and coming to this space. And I don't envy your work in balancing all these interests that are being presented by the communities. I know that like a lot of the community input has been, prioritizing of deeply affordable housing. That seems to be like the sentiment. But, there's also concerns about, accessing that housing, the different social determinants of health services that people be needing. I work at Neighborhood Legal Services. We have an office here, and we get people presenting a number of different legal issues, and we tend to be the only nonprofit legal aid in this area, and it's like the most accessible thing for them. Otherwise, they'd have to go, like 20, 30 minutes away. So I'm just wondering how you're, balancing, the community interest in terms of affordable housing and like the interest in like supporting their social determinants health needs, and how you're, pulling input from the different stakeholders. I know you mentioned you're going to the wellness center meetings, but if you can go a little more into like what you're doing as far as the community services needs.
Well, I won't tell you that that's easy. It's a process of constant feedback looping and making sure that we are synthesizing and hearing what the community needs are, and then talking it back to both the community as well as the stakeholders. So whereas the community may only say they want to do this, we need to make sure that that's balanced with, is that what other parts of the community are hearing? Neighborhood Legal Services is an incredibly important partner of ours. We work very closely with you, especially in the North Valley, with our block by block initiative that we have with Pacoima Beautiful. But, frankly, it's a synthesis of trying to understand how best to navigate through this process. But I will say that it's all done through the lens of humanity and what can work, because that's ultimately what we want to do, is actually have something happen. But it's not a perfect formula of like we run it through a computer and it tells us what to do. So it's a lot of listening and then figuring it out together.
So just as a reminder, of course, if you'd like to continue the conversation with Centennial, they are housing in offices in the third floor of General Hospital. And so we thank you so much again for your presentation today. With that, we are definitely way past time, but I appreciate everyone sticking with us. Thank you so much, Giovanna and Leandro, for joining us today. And we look forward to this continuing dialogue with you as we move forward into this project together. Our final word, we definitely invite you to join us on November 1st, Friday, November 1st. We're going to have face painting. We're going to have a petting zoo. We're going to have dancers, music, entertainment, and of course, a screening of the movie Coco. It's free and open to everyone, so we look forward to seeing you there. So we look forward to continuing our conversation. Thank you so much for joining us today.